Hello everyone. Today we are going to discuss about mental health and mental disorders. I am Dr. Suresh Padadmat, Professor of Psychiatry, Head of Telemedicine Center, Head of Forensic Psychiatry Unit at NIMANS, Bangalore. Before I start my presentation, I would like to have a disclaimer. This presentation is for academic purpose only, not for legal opinion. If you want to have a legal opinion, please do contact an advocate. Similarly, this presentation is for training purpose, not for treatment. If you want to have any treatment, please do contact professional psychiatrist for treatment purpose. Conflict of interest? None. This video should be used free of cost for training and academic purpose. Under no circumstances, this video should be used for commercial purpose. And please do remember, it's free, not to be used for commercial purpose. This video is part of the module on care of mental, neurological and substance use disorders for training of community health workers and staff nurse. And you can find the theory part of it in these two books, that is basically community health officers module on MNS, that is mental, neurological and substance use disorders. Similarly, staff nurse module on MNS care. Chapter 1 is the introduction for this mental health and mental disorder. The target audience for this video is community health workers who are going to man either the wellness center or primary care center, and also primary care doctors, RMPs, registered medical practitioner, nurses and pharmacists, or any other person who are going to man the wellness center or primary health center and who are going to be part of either national mental health program or a part of comprehensive mental health care at the primary care. So these are the target audience for which this video has been made. What are the learning objectives? Learning objective is to know about mental health, mental well-being. What are the various components which influences mental health? And next, third one is to know and understand about mental illness. What are the common symptoms and types of mental illness? And also causes and factors affecting mental health and mental illness. So these are the 5 important objectives we are going to learn during this video. Let's understand what is health. The World Health Organization clearly stated that health means it is a state of complete physical, mental, and social well-being, not merely the absence of disease or infirmity. This is the World Health Organization, which clearly said in 1970s. And the same definition holds good now also. Let's remember there are 3 components. It is a state of complete physical, mental, and social well-being, not merely the absence of disease or infirmity. So that's the complete understanding of health. But however, the 4th dimension has been recently added, that is spirituality has been added. But however, we are not going to discuss that at this point of time. Let's move further. So health. Hence, by looking at the WHO health definition, it is very clear there can be no physical health without mental health. That means to have a complete holistic health, mental health and social well-being plays a very important role. Let's understand what is mental well-being. So mental well-being of an individual implies that an individual is able to realize his or her own potential. What I can do, what I cannot do, what are my potentials? What are the positive points? He is able to realize, cope with normal stress of life. He is able to deal with the stressors of day-to-day, family problems, able to deal problems at the work, and he is able to be successful. Work productively and fruitfully. Also, make a contribution to her or his community. So these are the 4 components which clearly says mental well-being of individual which is doing well in the community. So these 4 points you should remember. Further, what are the components influencing the mental health? There are 5 components which have been identified. First and the foremost is resilience. Resilience is nothing but ability to bounce back after a stress or an event. For example, if there is a COVID and COVID related stress for the healthcare workers, yes, of course, is a stress, but how well you will bounce back immediately after the stressful event. That is what is called as resilience. For example, in a boxing match, their opponent will definitely punch you because he wants to win. So the opponent is called as stress here. Whenever he punches you, invariably you will fall down. So within how many minutes or within how many seconds you bounce back to the match is called as resilience. Until you quit, it is not called the match is over. The match continues until you quit. So here in life also, resilience means whenever there is a stressor, you have to invariably the life or the stressor will take you down, but invariably you have to come back. That is called as perseveration, maintaining the status of attitude to work. That is called as resilience. The person who is resilient will definitely go forward in life. Invariably there will be setbacks. Resilience means you are not affected by stress. You will definitely will be affected by stress, but you will be able to overcome the stress and you get matured and you work forward. That is resilience. Coming towards the second point, self-esteem. Self-esteem means what is the worth you feel about yourself? What is the value you keep yourself with regard to your family, with regard to your community, with regard to your friend circle? So what is the value you keep yourself? Many people will feel that I'm good for nothing. I'm not good for the community. I'm a burden on the family. So these are the poor self-esteem people who have problems. If a person feels that I'm contributing to the family, to the friends, to the community, they'll have a good self-esteem. It depends upon how you are going to look into the individual's life. Third one is emotional well-being. Emotional well-being has four components. That is understanding one's own emotion, understanding others' emotion, managing your own emotion, and empathy and dealing with other people emotion. So these are the four important points of emotional well-being. If the people, various studies have clearly said the leaders in the community are those who have a very good emotional well-being. That means they're able to deal with their emotions, they're able to understand their emotion, they're able to deal with their emotion, able to understand others' emotion, that is basically empathy, and also deal others' emotion. So that basically, if they are able to deal with emotion, that means you are going to be a leader. That means clearly understanding all our primary healthcare doctors, wellness center manning, community health workers, nurses, they're all leaders in health with regard to a village or a taluk or any district. So these leaders need to have a very good emotional well-being. If they do not have good emotional well-being, invariably they will have difficulties during working time. Hence, emotional well-being is very essential. Not only understanding the patient, you also need to understand how your staff is working, how is your staff nurse is working, how is the healthcare worker dealing with this problem at home and also working, contributing to the work at your primary care center or wellness center. So that emotional well-being plays a very important role. It is almost equivalent to emotional quotient. IQ, yes, it is required to get into a job. That is the first step. But to succeed in life, emotional well-being is very essential. So emotional well-being, please do remember, it's very, very essential in the life to go ahead and deal with these stressors and the society. The fourth one is spiritual well-being. Spiritual well-being have been very clearly demarcated, especially in research in cancer. Many patients who are in the second or third stages of cancer, and they have found that the people who are highly spiritual, they are trusting on nature or God or something high in the life they believe, and they believe in some goal, and they have faith and hope. Those spiritual people have a good outcome. The people who are highly spiritual will have a good immunity. They are able to even fight with the cancer cell. Many a time that has been found, they are able to overcome the cancer, and many times there is a remarkable magical things do occur. Their immunity takes over completely and they are get cured with cancer. So spiritual well-being plays a very important role, and just doing yoga, being within the self and able to let go things, so that spirituality play a very important role in holistic health. The last one is social connectedness. That doesn't mean that you are being connected virtually. You have millions of followers or millions of people as friends on virtual world. It's not your social connectedness. It's physical connectedness, how well you are going to help other people and how well they are going to help you. That means it's not only connectedness, it is emotionally connected to each other, helping each other. That plays an important role. Please do remember, human are social, social animal. Hence, they need to be connected. Coming to these are till now we discussed about mental well-being. Let's understand about mental illness now, because well-being we are able to understand, able to contribute to the society, to the family, and able to deal with stress and having resilience. Now, mental illness. Often you have seen people with severe mental illness in the society chained to the pillar or a tree or in a religious rehabilitation center or else even at home. They have been tied up because of various reasons. And you may also see wandering mentally ill on the roads. Please keep your eyes open. When you travel, you can find these people on the road and they'll be begging. Many times they are disabled. They will be naked sometimes. They would have not taken bath for many years or months. They will be stinking very badly. They will be worse than animals. They require support and help. So many a time we don't know, we feel that these are all beggars. Many a time they will be suffering from mental illness and they require help, they require treatment. Now coming to the understanding signs and symptoms of mental illness. So let's understand. There are two important signs and symptoms you can see. One is invisible and visible. So invisible is you can't see. The patient has to experience and he will tell. Insomnia. He says, I'm unable to sleep. So that's insomnia. And sometimes patient also says quality of sleep is very bad. Even in spite of sleeping for 8 hours, he feels that when he gets up, the sleep is not refreshing. So again, it's a classical sign and symptom of depression, anxiety. Decreased appetite. He doesn't feel like eating. Only family members may come to know who gives food, or else he himself will say, there is very good food. I love that food, but I can't eat. Weakness and fatigue. A person who is able to walk for 10 kilometers, now by walking 100 meters, he feels completely tired and stressed out. Weakness and fatigue, again a symptom of depression. Multiple somatic complaints. He will say like electrical sensation. He may say that I have a headache, body ache, backache, knee ache. Every joints in the body is paining. Not only joints, bones, and every part of the body pains. So that is multiple somatic complaints, again a somatization disorder. Numbness, paresthesia, long-standing headache, like tension headache, crying spells. Very often the person starts crying when a person connected to them asks, how are you? What's happening in life? Death wishes, suicidal ideas, increased heartbeat, palpitation, anxiety, sadness. These are the symptoms which very oftenly are not to be seen unless you talk to the patient or the family member who have these symptoms. Body image disturbance. A person may look normal, he looks good, but he or she feels that their nose is not correct, their lips are not correct, their breast is small. So these kinds of body image disturbance are very common in youngsters. Many a time they subject themselves for surgery, or else they go from one cosmetic surgeon to another cosmetic surgeon. So these are all very common, especially in Indian youngsters. Poor learning skills. That is SLD, what we call it as selective learning deficits. Especially you have seen in Tare Zameen Par movie, in that Amir Khan will be training a kid who has SLD in mathematics. He is unable to understand the rules of engagement in mathematics. Similarly, there are many children who find it difficulty to understand languages of Hindi, English, how to use verb, noun, all those things. They find it very difficult. Again, language, selective learning, but their IQ will be very excellent. Academic decline. Suddenly, the person who is brilliant starts declining in academics. Who is scoring around 90%, suddenly you find that he's scoring 30, 40%, finding it difficult to pass. So they're all early signs of severe mental illness. Decreased concentration, decreased memory, inferiority complex, negative emotions, alcohol and tobacco use. Don't feel that if a person is using tobacco, Smoking is a macho man or a macho woman or a liberated woman. No, these are all early signs and symptoms of mental illness. Drug abuse is also early signs and symptoms of mental illness. So these are all invisible. Unless you talk to the patient for some time, you'll not be able to come to know. But however, there are severe symptoms. These severe symptoms, no education is required to diagnose. You go to a village, ask anybody in the village who are the people who have severe mental illness. In a village of 1,000, invariably they will be able to name 7 to 8 people who are having mental illness in the locality. So, what are those signs and symptoms? Suspiciousness. These patients feel that somebody is trying to harm them, somebody is talking about them, people are looking at them, people are following them. These symptoms they usually say. Abnormal behavior, like talking to self, smiling to self, gesturing, or else they will be having hallucinatory behavior, violent, throwing stones, shouting, self neglect. Their personal hygiene will be very poor, disturbed biological function. Like biological function includes sleep. In the night, they will be roaming around, or else appetite will be very bad. Sexual functions will be completely changed or altered. Occupational function, they will not be able to do any work. And coming to social function, their social function is completely lost. So these are the symptoms, severe symptoms, which no education is required. Even an ASHA worker will be able to tell who are the people in this village have severe mental disorder, that severe symptoms. Let's understand. These symptoms, if there are one or two for a period of 2 or 3 days or 1 week, they do not be considered as mental illness unless they have biological dysfunction, social dysfunction, and occupational dysfunction. So these are the 3 yardsticks. One example I will give you. In every house, there will be marital discord. That means there will be marital difference of opinion regarding upbringing of the child. That doesn't mean that they have marital discord. It is a normal process of what we call it as the family growing. But however, because of the difference of opinion, husband wife starts fighting with each other almost daily. They stop doing their work. They're unable to go to work. They're unable to focus on their work. It is affecting their children, and they don't go outside together, or else their social functioning is completely stopped. Then only we call it as marital discord. They require family therapy. That means it should affect the biological function, social function, and occupational function. Then only we consider it as which requires intervention. Mental illness, it is similar. It is similar. And just having one symptoms doesn't mean that they have mental illness. They may require support just like counseling or supportive therapy. Let's discuss about the domains of mental symptoms. There are 5 domains: physical symptom domain, psychological symptom domain, thinking symptom domain. It is also called as cognitive domain, behavioral symptoms, and imagining symptoms. So these are the 5 important domains you should remember to classify or to know about the mental illness. Let's discuss each one of them. Physical symptoms are nothing but the physical functioning of the body related symptoms. The patient may say, I have body ache. He may say, I have multiple aches and pains, headache, backache, or also neck ache. Or also he may say pain in the body. He may say electrical sensation in the whole body. Or else he feels that his body is twisted. These are all basically physical symptoms. And also long-standing headache, easy fatigue. A person who is able to walk 5 to 10 kilometers, now after walking for 100 meters, he feels that completely tired. It's again a symptom of depression or else tiredness very easily. So these are all physical symptoms. Moving to the psychological symptoms is mental functioning. That domain is called as psychological symptoms. A person has fearfulness, worried to go outside, feels that people are trying to harm him, feeling sad, anger, irritable, anxiousness, is very panicky. Like the way in COVID, if anybody is sneezing, a person becomes anxious. So that anxiety, anger, frustration, these are all psychological symptoms. Coming to thinking symptoms, the way the person thinks is the domain which clearly decides. Attention concentration, is unable to concentrate on work, decreased memory, unable to take decision. He finds it extremely difficult to take decision. Earlier he was able to decide very fast, but now he finds it very difficult to decide. just to what to wear to the work he is finding difficult. Absent insight. He is unable to understand that he has mental illness, needs treatment. Delusions. That is abnormal thinking, or what we can call it as false fixed belief, even if there is a contrary evidence is present and it is beyond the patient's social cultural background. One example I will give you: delusion of persecution. In delusion of persecution, person with mental illness feels that people are trying to kill him. He will feel that even his parents, his wife is trying to kill him. He feels that food is being poisoned and he is very fearful. But in contrary, the family members are not trying to kill him, they are trying to help him. But he has that false fixed belief. People are trying to kill him. So that is delusion. And it is beyond the patient social, cultural background. But the counter evidence is present, but he still believes people are trying to kill him. So the delusions are very common, is a part of thinking symptom. Hence, schizophrenia is called as a thought disorder. Coming to the behavioral symptoms, the way the person with mental illness behave in the society, that is behavioral symptoms. Maybe singing, dancing in an inappropriate place, violent, talking to self, laughing to self, gesturing on his own alone, withdrawn behavior, deliberate self-harm, attempting suicide. These are all behavioral symptoms. Throwing stone at people, walking nakedly, disinhibited behavior. So they all fall into the behavioral domain. Coming to the last domain, imagining symptoms is basically hallucinatory behavior. It is the hallucination has been defined as a perception without stimuli. That means to see a thing, you should have a stimuli of an object. But here in hallucination, without a stimuli, the person will have perception. In a visual hallucination, he will see somebody, nobody else can see, but he is seeing. That is called as visual hallucination. Auditory hallucination, especially in schizophrenia, patient feels that he's hearing voices. He can't see them, but he feels that they have kept a speaker. He will be hearing multiple voices talking to him, but none of the family member are able to hear him. You will be hearing, sir, you will be telling his family somebody is talking. He will be searching those people around the house, but he will be convinced somebody has kept a speaker, and he believes that people are talking about him. But for the family members, it is completely not, they will not be able to perceive those auditory hallucination. So these hallucination means, especially auditory hallucination, it is a sign and symptom of mental illness. Visual hallucination, suspect organicity. That means organic brain syndrome. So these are the 5 domains of mental illness. Moving to the types of mental disorder. So this is basically for the purpose of treating, classifying at wellness center and primary health care center. We have classified into 6 important mental disorder you should know: common mental disorder, severe mental disorder, child and adolescent related mental health disorder, neurological condition, substance use disorder, suicidal ideation, and suicidal behavior. Substance use disorder is nothing but drug addiction, alcohol addiction, or else tobacco addiction. So invariably, in technical terms in medical, we call it as substance use disorder. Moving to the challenges in mental illness. So we know about mental illness, know about physical illness. What are the challenges? In mental illness, there is no specific lab test to diagnose mental illness. There is no blood test or urine test or any test to say, yes, this test is positive, means he has schizophrenia. There is no such test. No neuroimaging studies. Even there are, if you do a brain imaging like CT scan, MRI for a schizophrenia patient, it will be normal. Hence it is called as functional disorder. The pathology is at the synapses, neuronal junction. They increased or decreased in the neurohormones. That is the reason invariably nowadays they call it as chemical imbalance. In Hindi they call it as chemical ka locha hua hai brain mein. So hence these imaging studies or any lab test will be normal. So how to diagnose? The diagnosis is based on the 5 domains: talking to the patient, interviewing him, observing him, and talking to the family members. You'll be able to get good symptoms. These mental illness are invisible, and they are all invisible disability. They look fine in compared to physical disability, but they have a problem in function. The reason being is they have a brain disorder. We call it as mental illness. Majority of these persons with mental illness do not have insight into their illness. In spite of having schizophrenia, in spite of having severe mental disorder, they feel that they don't require treatment. They are completely all right and they refuse treatment. This is the biggest challenge. And many a time it is difficult to quantify mental illness unless you have been trained in psychiatry. But however, severe mental disorders, anybody can diagnose. The issue here is providing the treatment and continuing the treatment, helping the family member to cope with the person with mental disorder in their family. Further, the issue which amplifies in the society is stigma. Kalank bolte hai na? Stigma. Stigma. People discriminate them. People say a person with mental illness, they call him as mental, they call him as psycho, they may call him as ADA. So there are various name calling will be done. Imagine a normal people is called as psycho. How does he feel? Imagine a person with mental illness, what will happen to him? So the stigma, discrimination causes a lot of problem to person with mental. In spite of taking treatment and being normal, the people will continue to label them. The biggest problem is the not being aware of about the mental illness, the attitudinal problem. The in spite of being educated, not knowing about mental illness. So these are the problems which the persons with mental illness face. Not only the person with mental illness, their family members also will face. Non-availability of treatment, especially in developing world, access to treatment is a bigger challenge. Hence, they do not get treatment. Even if they want to get treatment, they have to travel to the district hospitals or else maybe to a medical college, which requires huge amount of money. Imagine for a person who is living on daily wages, he has to go all the way to the district. Not only patient can't go alone. Somebody has to accompany him. He has to go with him, travel, the money for travel, showing for him to a psychiatrist, the charges for the tablets, coming back, and the food charges at the place. So invariably, a person with mental illness, if he goes for a OPD visit, he will lose somewhere around 1,800 to 2,000 rupees easily, which is one person's 10 days daily wages. This is the unfortunate thing in it, especially in India. Hence, making the treatment available at the doorsteps is very essential for persons with. Reason being is mental illness is not an affair of one day, is not an affair of 1 month. These people require treatment for many months, sometimes even years. I will come to that. So this is a very essential point you should remember. These mental illness not only affect the person himself, it will affect the family members. Imagine a person with mental illness like depression is not going to work, is completely housebound and is completely crying, attempting to suicide, and death wishes are there. Imagine what will be the plight of his children, what will be the plight of the family members. One more example I will give you. Imagine a father is addicted to the alcohol and he is drinking almost daily. He is not worried or bothered about his wife, children, or his parents. What will be the status of the family members? They will be in constant fear, constant sadness. That means mental illness not only affects the individual, it affects the whole family. And invariably, it impacts the whole community. Let's understand. So, sir, what is big in this? Let's understand is the epidemiology. How many members are suffering in a community? How many are suffering in our state or in a country? There was a national mental health survey done in 2014 and 16 from the Ministry of Health and Welfare, Nirman Bhavan, Delhi. This study was commissioned by the Ministry of Health and was executed by National Institute of Mental Health and Neuroscience, Bangalore, that is NIMHANS. This study was done and approximately 39,500 individuals were interviewed across 720 clusters, 80 taluks, 43 districts, 12 states. And it found that psychiatric morbidity for lifetime was 13% and 10% for current morbidity. Severe mental disorder is 0.8%. So what, sir? It is 0.8%, 10%. Let's understand the complete population or general population. Our general population of India is somewhere around 138 or 139 crores. Let us make it as a round figure, 140 crores. 10% of them have current psychiatric morbidity, or else what we can call it as point prevalence. 10% means 14 crore population has one or the other psychiatric morbidity requiring professional help. So that is the morbidity. Along with severe mental disorder is 0.8%. That means 1 crore population having severe mental disorder. That is the morbidity we are talking. And it is not just 1 crore. 1 crore families are suffering. That means if 1 crore person have a severe mental illness, currently in India we call it as 5-member as a family. So another 4 crore people are also suffering. This is regarding severe mental disorder. If we take the prevalence of complete mental disorder, it is 10%. So approximately you can say there is no family in our country which is remain untouched with mental illness. Every family has one or the other mental illness. Maybe SLD, maybe phobia, it may be social phobia, maybe obsessive compulsive disorder, it may be depression, it may be substance abuse, tobacco dependence, alcohol dependence, drug dependence. So there is no family is left without being touched with mental illness. So the cross-sectional prevalence is 10%. That you should remember. That means if you go to any primary healthcare center and a PHC has a catchment area of 10,000 population, you should expect at least 1,000 population has mental illness. 100 people have severe mental disorder, that PHC area. Now it is the responsibility of the primary healthcare center to trace these 100 people, start on medicines, and make sure that every month they get medicine. Also, the medicine should reach their doorsteps through wellness center. That is what we call it as comprehensive mental health care at PHC, primary health care. That is the goal of our government, and it is the responsibility of each doctor to provide this care. And unfortunately, the treatment gap in this National Mental Health Survey is 70 to 80%. That means if you go to any village and find 100 people who are mentally ill, 70 to 80% of them are not on treatment. Only 20% of them are on treatment. If you look at alcohol disorder, 86% are not on treatment. That means out of 10, 8 of them are not receiving treatment. They are alcohol addicted. Neurosis, like social phobia, obsessive compulsive disorder, 83% of them, that is basically out of 10, 8 of them are not on treatment. Depression, again, out of 10, 8 of them are not on treatment. Only 2 are receiving treatment. Psychotic disorder, 75% of them not on treatment. Only 25% are on treatment. So bipolar disorder, 70% are not on treatment. That means you can clearly say that out of 10, only 2 people are on treatment. 80% are not on. This treatment gap is huge. So it is the responsibility under the wellness center and primary health care to make sure the medicine is available for the person with mental illness. That is the biggest challenge, and we have to make this treatment gap zero. Further, that is about mental illness. Looking at, there was one more important study which has been done by Ministry of Social Justice and Empowerment. That is called as National Survey on Extent of Pattern of Substance Abuse in India. That is alcohol dependence, tobacco dependence, and cocaine, cannabis dependence. This was a study done by All India Institute of Medical Science, New Delhi, along with Ministry of Social Justice. 2 lakh household survey was done across India. And this is one of the biggest study in the world. And 4,73,569 individuals were assessed. Not a small study, it's a huge study. And this report is available on net. It was released on 2019 by the Ministry of Social Justice and Empowerment. Let's see what is the reports. Reports are stunning. It's mind-boggling. Look at the number of alcohol dependence people. 3 crore population is dependent or addicted on alcohol. It is not just 3 crore. 3 crore family is suffering because of alcohol dependence. and look at the 5% of them are problematic alcohol user. That means the person takes alcohol, meets with an accident, has gastritis or various other health problems, but he continues to drink. He has social problem, he has economical problem, but he continues to use. So 3 crore has addiction, 5 crore people having alcohol related health problems, but they are continuing to use, and 16 crore are users, alcohol users. That means they are not dependent, but they use weekly once or twice. Let me remind you, 3 crore families are suffering because of alcohol addiction. Now we have to find them, treat them, and give solace to the family. Coming to the cannabis use, the dependence or addiction is 25 lakh people are addicted to cannabis. It depends upon the availability, especially in the Himachal Pradesh or else in the hilly areas of Himalayas. Cannabis grows very widely and it's available almost every part of the forest. So their use of cannabis is very high, and it is a part of, many times it's a part of culture also. So please do remember, 25 lakh people are dependent on cannabis. Users are many, but dependence is 25 lakh. Coming to the opioid dependence, 28 lakh people are dependent on opioid. Not a small number. It is equivalent to 28 lakh families are suffering. Imagine if one person in your family is drug addict or he is abusing or using opioid, what will be the status of the whole family? 10 lakh are cocaine abusers. 18 lakhs are amphetamine dependent. I'm not talking about abusers, I'm talking about addict dependent. 12 lakh hallucinogens dependent, and 7 lakh children are addicted to solvent abuse like sniffing petrol, sniffing glue, Erasex. They are using it and they are dependent on it or they are addicted to it. These are huge in number. So overall, my dear friends, 10% is conservative estimate of cross-sectional mental health morbidity. That means every doctor has a huge responsibility to identify them, provide treatment. And further, there is one more severe problem which we face in our India: death by suicide. National Crime Records Bureau in 2019 reported that 1,39,123 people committed suicide. That is death by suicide. It's not a small number. 1,39,000 people killed themselves. It is more than any terrorist attack. It is more than any armed conflict. The people are killing themselves. So a huge number, and majority of them are youngsters who are, many of them are earning family members. Imagine in a family, one person suddenly commits suicide. What will be the status of the family? How they will feel? So this is National Crime Records Bureau. Numbers are huge. Every day, this number can be calculated. Every day, 381 people are committing suicide. For every hour, 16 people have committed. For every 225 seconds, one person have committed suicide or completed suicide. This is National Crime Record Bureau, which is reported. Unreported are many. I'm telling these are reported to the police. Unreported, we don't know. Students committing suicide, look at the numbers. Every day, 28 students are committing. So these are all very difficult to digest, but that's the truth and reality. These are all I talked about completed suicide. Now let's understand about attempted suicide. World Health Organization clearly said for every one completed suicide, there are 20 attempted suicide and failed. That means in India, 1,39,000 people have completed suicide. That means into 20 is the number of people who have attempted. Approximately every year, 20 lakh people attempt suicide every year, which are reported again. I'm not talking about underreported. I'm talking about reported to police. Attempted suicide are 28 lakh. Imagine these 28 lakh people, family members have to take them to the hospital, provide treatment to them, and if they have attempted with organophosphorus poisoning or hanging, the treatment required for them is a huge, and that will be again a burden on the health uh, system. So completed suicide, 1.4 lakh, 28 lakh people attempt. So these are huge in number. Coming to the chronic medical illness, name a chronic medical illness like diabetes, hypertension, arthritis, chronic congestive cardiac failure, or COPD, chronic obstructive pulmonary disease. All of them have 30 to 50% comorbid mental illness. Any chronic medical illness, you get a free mental illness, which is 30 to 50% of them have. Not only that, at every primary care center, the studies have clearly said, even in India, 20 to 30% who attend OPD have mental illness. Either it may be comorbid or else independent mental illness. That means for every 10 patients who are coming to the PHC, 3 of them have mental illness and they are managed wrongly. They will be given either paracetamol or B complex. Sometimes even vitamin injections are given. So, my dear friends, we have to remember at any place, any part of India, 10% of the population has one or the other mental, which requires professional intervention. Coming to the other important, so what, sir? We have 10%. Unfortunately, you should know the course of mental. And I'm talking about rough estimate or approximate estimate of mental illness. There are 4 different types of courses which can be classified. First, let us understand episodic, one episode of mental illness. 30 to 35% of the patient will have one episode which lasts for 1 to 2 months or 3 months. They are completely recovered. Treatment is given. The treatment is taken for 6 to 12 months. Look at that. Here is an episode which is purple in color. The treatment is started. The treatment lasts for 6 to 12 months. The patient is completely remitted and he will never say that he has mental illness. He had mental illness. Never ever educate other people telling that I had mental illness, I am fine. Because of stigma and discrimination, they will never come outside and tell. So these are 35% in the population. They are doing well. They had one episode, they are recovered. They had one episode of depression, they are recovered. Unfortunately, they don't become the ambassador telling that please take treatment, is curable. These are the 35% are curable. Understand? 30 to 35% are curable. This is the first. Second, there are mental illness which they take treatment. They have been started a treatment. In 2001, they took treatment for hardly 1 to 2 months. They discontinued treatment. Once they discontinued, invariably there will be relapse. These are all treatable. On medication, they do very well. They function very well. And they are absolutely normal. So these are all around 35%. So first one is 35% completely remitted. They never say that they had mental illness. They need not require medication. Next 30 to 35% on treatment, they do very well. So these are the people who need, usually they come out and say, I have mental illness, I'm on medication. But unfortunately, because of stigma and discrimination, they also not tell anybody. Please do remember, these people require medication for years. The third, again around 20 to 30% of them, on medication, the symptoms will decrease. Off medication, they become violent. Here, that means with medication, the symptoms improve, but they do not become functional. So approximately 20 to 30% of them on medication, their symptoms are controlled, but they are not functional. The last 10%, whatever medication you give, they will have symptoms. They are called as chronic resistant illnesses, which require continuous rehabilitation center or to be in a supported accommodation or sheltered accommodation. They need support. They cannot be independent. These are the 10%. To summarize, my dear friends, 35% one episode complete remission, another 30 to 35% on medication, they do well. So approximately 70% of the population, they do well on medication. Hence, please do not stop medication. Mental illness is a brain disorder, and by giving medication, you will be able to do justice to them. And do not stop medication without psychiatrist opinion. Unfortunately, many of the doctors and nurses say that, why are you taking psychiatric medication? Do you think you are weak? And they make them to stop medication. Once they stop medication, they have relapse. They may become violent. They may become suicidal. Unfortunately, recently, one of the celebrity stopped medication, suicidal ideas, committed suicide. So, do we want that? So, without knowing anything, please don't stop medication. Mental disorder is a brain disorder similar to epilepsy. That means a person has epilepsy or a seizure, you start medicine to stop epilepsy or seizures. Once you stop it, you continue for 1 or 2 years so that as a prophylaxis so that it does not come back. That is called as kindling of the neurons or kindling of the brain. Hence, you give it for 2 years. So please do remember, similar to epilepsy, mental illness also has kindling effect. If you will give medication to stop an illness first, and then so that it does not relapse, you continue for 1 to 2 years. Hence, my dear friends, don't stop medicine immediately. Take a psychiatrist opinion how long to be continued. And the medicine has to be tapered slowly, similar to epilepsy. Medicine should not be abruptly stopped. If you stop abruptly, there is a chance of discontinuation problem, and the relapse will be very high. So let's understand what are the causes and how the biopsychosocial model plays an important role in the mental illness. There are 3 important points here: biological, psychological, social. Hence, we call it as biopsychosocial causes of mental illness. Let's understand about biological reasons. Genetic vulnerability. If the father or a grandfather has a mental illness, there is a high chances his children will get. Similarly, if a person has disability, there is a high chance he will develop mental illness. If a person is abusing alcohol, high chances he will develop mental illness. Although alcohol abuse or alcohol dependence itself is a mental illness. So biological factors play an important role. But however, the biological factors like genetics requires an environment to express. That is called as social. Imagine peers pressure. Peers pressure means friends are forcing him to take alcohol. Yes, social factors. Family circumstances, marital discord can cause mental illness like depression. School bullying, bullying in school can cause mental illness. Coming to the psychological, how he thinks about himself, self-esteem. What are the coping skills he has learned from the family members? What is his social skills? So these are all again psychological domain which causes mental illness. But all these 3 factors play a very important role. Positive factor, maintaining mental illness, and also if you are able to intervene all these 3 domains, the mental illness can be cured or treated. So these are biopsychosocial models. Let's understand each one of them. Let's take the biological factors. These biological factors: chemical imbalance in the brain, that is neurohormones like dopamine, serotonin, norepinephrine, adrenaline, so noradrenaline, those are the things. Genetic cause, brain injury. Head injury can cause mental illness. Epilepsy can cause mental illness. Chronic medical illness can cause mental illness. Drug abuse can cause mental illness. They're all biological factors. Coming to the childhood events, violence against children, sexual abuse against children, emotional neglect or emotional abuse to the children, death of a parent, poor family or family discord can cause events in the childhood, can increase the likelihood of mental illness. Social factors like unemployment, poverty, poor housing, and early children, or what we call it as a young girl is having child at the age of 17 are prone to have mental illness. Psychological factors like poor self-esteem, negative thinking can cause mental illness. You can see the risk factors here and then the level and the protective factors. Risk factors are pessimistic attitude, low self-esteem, substance use, poor lifestyle at the individual level. That means if a person has negative thinking more, pessimistic attitude, self-esteem, alcohol abuse or drug abuse, poor lifestyles, getting up late, eating whatever junk food can cause mental illness. At the same time, protective factors having hobby, physical activity, meditation, yoga protects them. At the family level, that is at the second column, broken families, harsh disciplining styles, family history of mental illness and substance abuse in the family causes mental illness. On the other hand, protective factors are supportive parenting, caregivers, family harmony, stability, strong family values and culture will protect from mental illness. At the community level or society level, the last column, discrimination, isolation, stigma, lack of access to support, lack of access to treatment, socioeconomic disadvantage, and poverty at the risk factors. Coming to the productive factors, availability of treatment, access to support services, community networking and helping the persons with mental illness, cultural identity, pride, acceptance, economic security, microfinancing helps in protecting factors. So, my dear friends, there are risk factors, there are protective factors. So, as a person in the health department, need to increase the protective factors and decrease the risk factors so that you can do the intervention at the individual level, family level, and the community level. To conclude, my dear friends, we as a healthcare workers have a huge responsibility in our country regarding psychiatric morbidity. We need to treat 10% of our population. But unfortunately, the human resources are very less, especially mental health human resources. Approximately, we have 10,000 psychiatrists, 2,000 clinical psychologists, 2,000 psychiatric social worker, and psychiatric nurses, maybe around 3 to 4,000. So, taking all together, they are not more than 20,000 mental health workers for a population of 10 crore requiring help. My dear friends, unfortunately, just by increasing MD psychiatry or diploma in psychiatry, will not be able to take the treatment to the doorsteps in the rural area. A person who has done MD or diploma unlikely is going to work in taluka places or else at the primary healthcare center. Or even a MPhil holder in psychology, that is clinical psychologist, or MPhil holder in psychiatric social worker, unlikely they are going to work in PHC or in the rural area. There are various reasons. Nothing to do with mental health professionals. Even a lawyer will not work in rural area, or an engineer will not work in rural area just by telling that I don't have good infrastructure there. There is no school for my children. My wife will not come there. So there are various reasons they will give. That means the more you are educated, the more you go away from the rural area. You will be working in a metropolitan city or else maybe in a urban like district area. So this is a paradoxical part of our life. The more you are educated, you should be with the people who require your help. Unfortunately, I have been educated, but I am away from the community. I am in a metropolitan city. So this is the hard truth. So what should we do? We should empower the local people. Hence, Asha worker training played a very important role in addressing the physical health of the community. Similarly, in mental health, we have to empower a person who is in the community, who is going to stay in the community, and we should empower him how to treat them, their own people with mental illness. That means we have to come with innovative solution. Just by increasing doctors, having MD more or a diploma is not going to address the issue of health in rural area. We have to empower the local people. Hence, the innovative solution is required. Hence, to do that innovative solution, then only we can reduce the treatment gap, my dear. And it's not only the responsibility of the doctors, it is the responsibility of the government and each and individual to see how can empower the local people. Hence, we have to have task shifting and also deprofessionalizing some of the health care sectors. Let me be very clear, the mental health care should not be left alone to mental health professionals. It has to be part of the whole community at large. Then only we'll be able to make a healthy population in our country. Not only in our country, you take any country. It should be, the health should be everybody's agenda, not just a doctor's agenda or a nurse's agenda. Dear friends, mental illness are treatable. Stop exclusion, dare to care. Dear friends, thank you very much for giving your valuable time. Stay safe.